I'm Dr. Teresa Green with Align Chiropractic in Richmond, Virginia, and we are talking about sleeping ergonomics. So we've already gone over how to determine whether your pillow is proper for you for side sleeping. This one fits my body perfectly. The next thing are some common problems people have with positioning themselves. So as I am lying down on my side, arm positioning is critical. So you do not want to do this or this. Reason being, this position here pushes my head up, alters my head positioning, not so happy for my spine. Also, this rotation, whether under here or here, can actually be really hard on your shoulder and the rotator cuff, so you don't want to do that while you're sleeping all night long. Arm positioning should be no higher than 90 degrees and should be between 45 and 90. So you can bring your arm this way and just let the other arm fall down. If you're struggling with that, you really feel like your arm just needs somewhere else to be, take those lovely decorative pillows that have no use except to be taken on and off the bed and hug it. This helps to keep your arm in a nice position. It teaches you to have something to hold on to so that you resist the urge to rotate your shoulder this way. Another position option is you can let this arm just fall out. The challenge people report is that their elbow starts to bother them from having that arm extended fully all night long. So you may want to take, again, that lovely decorative pillow and put it out so that your arm has a slight bend. Or you might take your sheets and blankets and bunch them up a little bit underneath your wrist, which I can't show you well in this video. But bunching those blankets gives you just a little bit of a bend in that elbow so it's not fully extended all night long. The other consideration is the lower portion of your body. Many people, when they side sleep, tend to do this all night long, which puts a lot of rotation in the hip and the lower back. So you can take, usually a bigger pillow is better, but you can put one pillow here in front if you tend to be the person that brings your leg forward, or you can take your pillow and put it between your knee and your ankle and sleep on your side. It may not stay that way all night long, but at least you're minimizing the amount of time you're in a fully rotated position throughout your night. So try these tips. I hope they help you get a better night's sleep and help you take care of your spine.